Well, Gauteng is officially the country's epicentre of the coronavirus, with more than 75,000 confirmed cases. The Provincial Command Council briefed the media a little bit earlier this afternoon, and of course Premier David Makhura, who tested positive for COVID-19, was not at that briefing. Someone who was the Gauteng MEC for Health, Mr. Bandile Masuku, who is about to get into conversation with my colleague Khayelihle Khumal. Khaya, it's over to you.
Well, so that's right, Duduzile. So the very main mission in Gauteng is about trying to save lives. So just a short while ago, there was a very comprehensive presentation about the state of COVID-19 in Gauteng. We've just passed the 80,000 mark. But so far, it's quite interesting that the active cases, obviously, we haven't really seen a surge in terms of the massive numbers of people just requiring hospitalization. So far, it's only just mild symptoms and people just taking care of themselves at home. So MEC Masuku joins me now. So MEC, thank you so much indeed for your time. So your boss is not around here. Obviously, I would imagine that you've expressed well wishes for him. So far, what do we know?
I think he's okay. He has not had many symptoms. He's in high spirits. And we're just looking after him in terms of vitamins and other aspects of the treatment. And we're hoping that he will recover and come back soon to lead us.
And obviously, MEC, I mean, as part of the WHO protocols, do we know so far if certain people would be quarantined? He might have been in contact with, key figures in the province.
Yes, the people that he was in contact with, they are also in quarantine and they are isolated. Some of in quarantine, mainly waiting for their results. Some of them have already received their results, and the results have put them on the clear. So we are just hoping that everybody who has been in contact with him would be okay.
And obviously, your key message, MEC, you said you are treating Gauteng as a whole, as a hotspot, as opposed to looking at certain areas, obviously given the fact that it's a very interconnected province.
Yes, I think that's the basic message that we want to give out to the public, that all the parts of Gauteng do have active cases, and it doesn't matter where you are. It just means that you must take extra precautions and make sure that you are able to prevent yourself from getting infected. And it also makes sure that people don't get into spaces or organize unnecessary social events. Because when you normally say this place is a hotspot, the other one's a hotspot, people then who are not mentioned, they think that they can actually do as they please.
And just before I let you go, MEC, what are some of the areas that you're looking at? We know that you're preparing for the peak. You've put quite a lot of resources trying to get as much beds as possible. But what are some of the areas where there are challenges?
I think we have passed the plan of planning. We are now in a plan of implementing all what we had thought that we should be put in our plans. The fever tents are coming up and they are starting to function. We went to see another one with the minister this morning in Steve Biko, which has got all the capacity of oxygen and also giving some form of critical care. And these are the tents that are going to help us in a main to decongest our casualties, which are the ones that normally suffer a lot with patients that are waiting beds and they are waiting results. So with the fever tents, it's going to help us in a great deal in that space.
And just your facilities, as a last question, how are they doing so far? You just said that you want to add over 1,000 bed capacity at your hospital in Nasrec, but generally, by and large, how is some of your institutions doing?
Our institutions are under strain, pretty much under pressure. And remember that usually winter has got its own pressures. And now with the pressure of COVID, it has made it more actually strenuous. But I think with us managing the beds quite well between ourselves as a public sector and including the private sector, it has managed to actually somehow relieve the pressure. And we want to continue to master the issue of bed management, and we have learned that also from Western Cape, that we really need that coordination. It will make it easier for EMS, for anyone to know which hospital is admitting, and no patients actually gets to be turned away from our hospitals.
All right, MEC, thank you so much indeed for your time. So that's Gauteng Health MEC, Dr. Masuga, really explaining about some of the key measures that the province is taking. We know that we are the epicenter, so the key message is adhere to all the key regulations to protect yourself.